I'm Dr. Reema Kashiva. I'm MD in medicine and specialized in diabetes and bariatric medicine. I am practicing for almost 20 years now, and I've been practicing in Pune for past 12 years in Noble Hospital. Actually, on the basis of weight and height, we calculate BMI, which is body mass index, and it is on the basis of the values. Like if the value is between 25 to 27, we call it as overweight, and if the value comes more than 27, we call it as obesity, and more than 30, as the value in terms of BMI keeps on increasing, the adverse effects of overweight or obesity keeps on increasing, and something above 35 and all we call as morbid obesity. There was a time when only diabetes was considered to be an epidemic in India, and diabetic was considered to be more of a disease or a condition prevailing in the urban population. But the scenario is now completely changed. It is being found that diabetes is mostly associated with obesity. And since diabetes and obesity are associated together, so the newly coined term is diabesity, and that is the epidemic actually that is increasing in India. And we in the world are called as the diabetic or obesity capital of the world, which is not a very good thing and which really needs to be addressed in our country. And the reason for this is not something which comes in the later part of the life. The reason starts right from the time when a child is in the mother's womb. Then the childhood of a particular person, the growth of a particular person, the eating habits, lifestyles and many other things in childhood, adolescence, and then as the person grows on, adding on to what leads to obesity, and then that obesity leads to diabetes or an overall metabolic syndrome. Actually, obesity means the fat index of the body is increased. Now the fat index is divided into multiple times. Like it can be like a person can be of normal weight, but he can be still obese in the terms of having a central obesity. So we do calculate obesity in terms of waist hip ratio, abdominal circumference, and by many other means. So what happens exactly in obesity is the fat in the viscera or inside the body is increased, which leads to insulin resistance. Insulin and fat are considered to be a sort of enemies. When fat is more, the insulin doesn't work, and when insulin doesn't work, the blood sugar increases. So together these also leads to a lot of other disturbance in the body, and that leads to a complete syndrome called as metabolic syndrome or syndrome X. So this is how obesity leads to diabetes or metabolic syndrome. Diabetes can be purely genetic, which happens in children, which is called as type 1 diabetes. Diabetes, if it is not a type 1 diabetes which is purely genetic, and the diabetes which happen in adults, the causes are again variable. And usually in adulthood, diabetes is not caused by just one factor. It is a mixture of many factors like poor exercising habits, poor eating habits, lot of stress, and added on by genetic. So a proportion of each adds on to diabetes in adulthood. Maybe something is more and something is less. So out of these, the most important reasons that have been found in adult type 2 diabetes is the stress in present lifestyle. A diabetes that comes in more than 50, 55 is usually related to the aging of pancreas, or the pancreas cells getting older or exhausting as per the aging process. But nowadays we see the onset of type 2 diabetes in mature adults. So the usual cause is stress and partly added on by genetic. It's one of the very interesting question actually, and the shortest answer that I have is from the tip of the hair to the tip of the toe, there is not a single thing that is not affected by diabetes or obesity. When you are obese or overweight, even if you don't have diabetes, you are at risk of having so many other comorbidities, like you have obstructive sleep apnea, you are prone for having cerebrovascular accidents or paralysis. Not having diabetes also, you can have heart attacks and paralysis, kidney disorders, lot of cancers are associated, musculoskeletal disorders, osteoporosis, osteopenia. The quality of life because of being obesity is badly affected. So obesity per se leads to all the risk factors that is there in this world. Like almost every disease comes with obesity, even if you don't have diabetes. Over and above that, if you are obese and you have diabetes also, the risk of everything just doubles up, or rather quadruples up. So nothing is left when you have both the things together. It's like a life-threatening disease. At any stage of life, lifestyle has to be managed. You need to know how to balance stress in present situation. You cannot escape stress. You will have whatever you are working. Even if you are a simple homemaker, you have different types of stress. So how to live with that stress, or how to balance that stress with the present lifestyle that we have, how to cope up with the work and family together, and how to have a balanced life, how to find time for yourself to exercise, because nobody have time to exercise. What should you know about the diet, that what a healthy diet means? What sometimes we eat, we always think that what we eat is the best, but it is not the best. So we should be always guided by an exercise specialist or a nutritionist to understand what is good and bad for us. The only thing that I feel in an older population that can be done, yes, of course, to teach them how to balance, but more to teach them how to balance their younger generation. A grandparent guiding the second generation of their grandchildren to balance life from there. That would really solve out the problem from this country. Without damaging anybody's self-esteem or anybody's degrees or qualifications or expertise in the field of nutrition, I, being a person in allopathic medicine, is purely guided by what the guidelines says and how the physiology of the body is. The physiology of the body is that the pancreas or other organs of the body secretes digestive enzymes and juices and insulin periodically in the body. So what the science says is, all that you do in this life should balance or should match with the physiology of the body. So anybody who is advising a diet that is matching with the physiology of the body, I have no objection to it and I'm open to accept it. But anybody who goes against the physiology of the body, like two-meal diet, I don't understand really the fundamentals behind it. I don't oppose it, but I really sometimes find that maybe in the initial stage that works, but in the later part that's not working, because ultimately the body is made for something. Like, you are meant to sleep in the night and you're meant to work in the day. When you don't do that, you land into diseases because the circadian rhythm of the body is disturbed. So what I truly follow are or ask my patients to follow is the dietitians or the nutritionist who follow the guidelines laid down by Indian Diabetic Association, American Diabetic Associations and WHO, which are FDA approved and that matches the physiology of the body. I am a person who is working on prevention of the disease for more than past 15 years. When a patient comes with certain stages of life where I have no option other than treatment, I have to treat, because that's my degree, that's my qualification and that's my expertise. But truly I'm working a lot on the prevention part of it, as I told you, in children, in obese adults and early. So to start with, unless there is a major complication, I really focus months and years together to make a person understand about the importance of lifestyle management. And I give them a lot of scope to first improve by natural ways, and it really works. It is not that a person cannot lose weight just by lifestyle changes. It's all on the willpower, but the only thing is it has to be properly guided. So what I truly follow as a bariatric physician is a team approach, wherein I am a physician, I have a trained nutritionist for weight loss who does guided diet plans which are completely individualized on the basis of what a person is, and then I have got an expert who's trained for the exercise part, because every individual is not fit for every exercise. So even that is an individualized approach. Plus I have got a counselor who makes a particular person understand the role of each and everything and the importance of weight loss in life, and that too achieving it through normal leave. So I work as a team, and my team mainly focuses on without drugs or without surgery. But in spite of these, and yes, with this approach only, to be very honest, we have been able to achieve a weight loss of 25 to 30 kgs in our people without the use of any drugs. But there are certain stages in a particular patient or a person where we do not or we cannot be dependent only on lifestyle management, and we have to be a bit aggressive. The percentage is very less for me, like maybe 1 in 100 per patient of mine. I've asked them to undergo bariatric surgery, but then when we feel that it is needed, it is needed, because that is the stage when nothing is going to work out, and those are usually the stages when a person is fighting with many other comorbid situations. For example, obstructive sleep apnea, where life itself is in trouble, or complete inability to move, where a lot of depression comes in, or hypertension not getting control, or very high sugar level not getting controlled by the routine set of treatment that is available. So we do advise bariatric surgery to a couple of people who are the right candidates for it.